So in this video I'm going to demonstrate using Graston technique to treat the supraspinatus muscle, the most superior muscle of the rotator cuff. Again, this is a muscle that when it's irritated, the trigger points in it can refer pain down the side of the arm. And sometimes the patient may feel some referral of that pain when we're actually working over those trigger points, which is not a bad thing. We know we're in the right spot when the patient's getting that. When a lot of times it'll completely reproduce their symptoms, but we can desensitize that area and soften that up, and so the pain will be less and that radiation of pain will be less after our treatment. So usually what we're going to start with, the supraspinatus lies just in front of the spine of the scapula here, deep to the upper trapezius. And in most patients with neck or shoulder problems, this muscle is going to be high tone, so we're going to have to do some work to treat out that upper trapezius first. So in this case, I'm just demonstrating real quick with GT number 4 how I might sweep and fan through that upper trap to soften that up, so then I can come back and get to supraspinatus after that. Okay, so that's just a very brief demonstration. But then to get after the supraspinatus, I'm going to come in with something smaller, GT3 in this case. The muscle tendon junction lies right here where the clavicle and the acromion come together. So to get down into that space can be very beneficial. But then I'm also going to work right along that border with the spine of the scapula, and that's my access point to supraspinatus, to do a little bit of sweeping through there. Okay, or I can also do a little bit of a pulling away from the spine, trying to get under that upper trap and on top of the supraspinatus. And if I wanted to add some movement and do more of like a pin and stretch, what we could do is, let's take this arm out, and then she's going to start abducted, and then she's going to finish into internal rotation behind the back. As she goes, I'm going to flip the instrument upside down so the treatment edge is on supraspinatus. I'm going to pin that, go ahead and move nice and slow. She's going to do the moving, the muscles pulling underneath the instrument. Come on back out. Just a couple more like that. Okay, taking up tension and then letting her do all the work. I'm just holding the instrument still. Okay, if someone was going to just do it manually, like a pin and stretch or an active release technique, one could just pin the muscle here, go ahead and go again, and do the same thing with your thumb. Okay, following right along spine of the scapula, and relax. Okay, so that's a demonstration using Graston technique to treat the supraspinatus. Again, could be done manually as well, but Graston technique has been very effective for rotator cuff tendinopathies, issues with the supraspinatus through there, and decreasing pain and getting people moving again.